I'm here this morning to make an important announcement about new actions to contain the COVID-19 virus in Alberta as we begin lifting public health restrictions and relaunching aspects of our economy under the relaunch strategy. International travel obviously played a key role in the spread of the novel coronavirus. We live in a world of unprecedented mobility. More people have greater access to international travel than at any time in human history. And almost everywhere that the virus took hold, the initial cases mainly involved international travelers. Countries that most successfully avoided severe outbreaks, like South Korea, Singapore, and Taiwan, closed their borders from COVID-19 hotspots weeks before Canada did, months in some cases. As late as mid-March, when the number of reported cases globally was surging to over 100,000, with hundreds of Canadians and dozens in Alberta, hundreds in Canada, I should say, and dozens in this province, federal border and airport security protocols remained lax. On March the 16th, I visited the Edmonton International Airport to see for myself and immediately directed Alberta government officials to bolster screening and information of international travelers arriving at our airports. I want to thank the Government of Canada for subsequently improving airport screening and isolation protocols and shutting down illegal border crossings. But given that airports and border crossings remain a high-risk vector for transmission, and at the same time a crucial part of the infrastructure we need to get our economy moving, we need to do more. We need to do more, especially as we move towards relaunch. Although international travel has declined drastically, there are currently about 400 people a week arriving at our airports from outside the country, mainly at the Calgary International Airport. That's why today I'm announcing several new measures to strengthen protections at our international airports against the spread of COVID-19. These phased-in actions build on the order issued by the Chief Medical Officer of Health on March 25th, under which international travelers are legally required to self-isolate for 14 days upon arrival. In the first phase, effective immediately, international travelers arriving at the Calgary or Edmonton international airports will be required to pass through a provincial checkpoint where they will undergo a thermal temperature screen and provide a detailed self-isolation plan. This will occur after travelers have cleared customs and COVID-19 screening by the Canada Border Services Agency. In their plan, travelers must detail how they will travel to their self-isolation location, how they will obtain food and medications, and will identify who, like family, friends, or others, will support them as they self-isolate. Those who do not have access to private transportation or transportation that meets physical distancing protocols will be provided with temporary on-site quarantine facilities until appropriate transportation can be arranged to their self-isolation location. In the second phase, to be implemented within a couple of weeks, a similar provincial checkpoint and screening protocol will be established at the Alberta-U.S. land border crossing at Coots, where about 90% of land border arrivals come through. All international travelers arriving in Alberta via the airports or that land crossing will receive a follow-up call from provincial officials within 3 days to confirm that they are following public health orders and that they have the support that they need. And we'll be providing for hotel accommodations for travelers who have arrived who do not have adequate support or an adequate self-isolation plan. In addition to the new screening protocols, several other protective measures are being introduced immediately at airports. These include enhanced cleaning requirements for airport arrival lounges and high-touch services, and installing hand sanitizer dispensers at every kiosk and touch screen machine at the CBSA arrivals areas. I'm also directing Alberta public health officials to monitor those cleaning and physical distancing protocols at international arrivals in the CBSA area. Finally, as of next week, all arriving passengers in Calgary and Edmonton will be subject to thermal scanning for fever, which AHS reports is a COVID symptom in almost 30% of Alberta cases. Our new measures align with the federal government's emergency order under the Quarantine Act, requiring people entering Canada to provide a plan for self-isolation for 14 days. But they provide another level of monitoring and enforcement by on-site provincial authorities, including thermal scanning, which is not currently occurring under federal screening protocols, in order to ensure that Alberta has the strongest health protections in Canada against the new COVID-19 infections entering our province from international travel. I should add that Ottawa's Global Travel Advisory remains in place, along with the Stage 1 provisions of Alberta's relaunch strategy, recommend against non-essential foreign travel. Moreover, yesterday the Prime Minister announced that Canada and the United States have agreed to extend restrictions on non-essential cross-border travel for another 30 days. Under our relaunch strategy, we do not anticipate lifting restrictions on non-essential travel until we get to Stage 3, and it's not possible to say yet what day that will come. When it does come, however, we can be confident that actions like these that we're announcing today will help keep Albertans safe from new infections from international travel. I'm confident that travelers will understand that these actions are practical measures and reasonable inconveniences that are necessary to contain the virus and keep Albertans safe. I think for the vast majority of people it will at most add a couple of minutes to their arrivals. As, or more importantly, they are the protocols that will provide the effective protection that we need in the weeks and months ahead as we implement our relaunch strategy to lift restrictions and get all of our economy moving again. It will be many months before we can expect effective antiviral treatments or a vaccine that ends the threat of COVID-19. In the meantime, the new normal will involve protective protocols like the ones we're introducing today, and this is something that I discussed in my televised address several weeks ago when I said that the we had to be prepared for relaunch by taking stronger, more targeted measures, including stronger self-isolation measures for international arrivals and stronger screening, which is exactly what we are implementing now. Just as we adapted to other airport and border security controls that have been put in place over many years in response to public security threats, we'll adjust to these new ones. Our priority will always to keep Albertans safe. So thank you very much, and I'm happy to take questions, and I am joined here for questions, if there are any, of a more technical nature, by Chief Medical Officer of Health, Dr. Hinshaw.
Okay, operator, can you please put through the first caller?
First is Chris Barco with the Calgary Herald. Go ahead, Chris.
Hi, this is a question for the Premier. Premier, I just wanted to ask you about the fact that today the Prime Minister announced more details on the Canadian Emergency Commercial Rent Assistance Program. But some tenants are saying that their landlords aren't actually choosing to participate in it or extend it to them. And they also think that the program needs to be extended beyond the 3 months of April, May, and June. I guess I'm wondering, do you think the program needs to be extended? That's my first question. And secondly, would the province look at some sort of changes that are going to require the commercial landlords to actually join the program and provide some sort of a rent relief to these small and medium-sized businesses?
Chris, did you say the Prime Minister announced revisions to the commercial tenant relief program today? I guess we've already lost Chris. I wasn't briefed on his statement. Sorry, I was chairing a cabinet committee meeting all morning. But we have heard. First of all, we want to thank the federal government for having launched that program and made that support available. We did announce shortly after the federal government's initial commitment that the government of Alberta would participate in the program with the maximum provincial portion for Alberta. That would be about $67 million. And I think that would be joined by about a $300 million federal contribution. We have heard from a number of commercial tenants that for various reasons the program did not appear to be accessible to them or working for them, in part, as you've said, because some larger commercial landlords have chosen not to participate. So we have gone back to the federal government with some recommended changes to expand eligibility for the program. And I hope that those are some of the measures that have been taken. If there are revisions that have been made, we will quickly analyze those. We'll consult with the business community in Alberta, particularly with small and medium-sized businesses who are under the greatest distress. And at the end of the day, we'll continue to work with the federal government to ensure that there is some commercial tenant relief available for distressed small and medium-sized enterprises in particular. And I can tell you the government of Alberta is also considering its own suite of measures to help those as small and medium-sized businesses that in particular have been impacted by our public health orders. So I would just say stay tuned for further announcements in that regard.
Operator, can you please put through the next caller?
Next is Kelly Kreiderman with the Globe and Mail. Go ahead, Kelly.
Kelly, are you there?
Hi there. Premier, I'm just wondering which public servants will be taking everybody's temperature, and did you consider enacting these kind of checks or this kind of screening at provincial boundaries as well?
I'll take the second question first. I suppose, yes, we have considered it at various times over the past 2 months. We have looked at that possibility of some kind of interprovincial border screening. Some other provinces and territories have instituted that screening. For example, Albertans going north to the territories are screened, and I think New Brunswick and PEI have similar measures in place. But we have decided not to institute such measures. We don't believe that they are necessary. Although we do discourage non-essential travel between provinces, at this point we do not see a compelling reason why we would do that. And in fact, I can tell you that I've spoken to Premiers Horgan and Moe in our neighboring provinces, and we're all of one mind on that. On who will do this, they will be officials from Alberta Health Services who will be deployed to Calgary and Edmonton international airports, the arrivals areas, as well as to the Coutts border crossing. In the case of the Coutts border crossing, we'll be setting up a secondary screening facility just north of the CBSA screening kiosks. And we estimate, I should say, that this program will represent a cost of about $800,000 through to the 31st of August. And that includes support for hotels and hotel rooms and per diems for international travelers who do not have adequate self-isolation support, analogous to the program that was rolled out by the government of British Columbia a few weeks ago. So we're basing our costing. They've had, I think, only 1% of their international arrivals that did not have adequate self-isolation plans or support who they had to provide shelter to in airport area hotels.
Operator, can you please put through the next caller?
Next is David Staples with the Edmonton. Go ahead, David.
Good morning. In terms of moving forward with the phased opening of things, I just want to clarify the numbers that will drive either moving on to phase 3, reopening even more things, or a further lockdown. And I understand that in the past, Dr. Hinshaw said that we need things to be stable or declining, and we don't want to see something as much as a 5% increase in hospitalization. My question is, with hospitalization so low, a 5% increase in hospitalization would be quite a small number of people being hospitalized, and that would trigger, it sounds like to me that would trigger not proceeding with any more opening up, and might also kind of spur the lockdown to start again. So I'm just trying to get my head around that 5% number in terms of it being a trigger for something, and if there's any other numbers that are going to be taken into consideration. I think Dr. Hinshaw mentioned something like that ICU beds would have to be at a certain rate of occupancy to trigger a further lockdown, backing away from the opening up. So I'm just wondering about that.
Sure. Thanks, David. Dr. Hinshaw happens to be here, and I'd invite her to supplement my answer. Let me just say, those are all very pertinent questions. In fact, just last night at the Emergency Management Cabinet Committee, we were discussing exactly those issues because we think it is important to provide clarity for the metrics, clarity to Albertans on the metrics that we are tracking for any potential changes in policy, whether relaxation or greater stringency in public health measures. And you're quite right. Look, the whole premise of what we've done over the past couple of months was, of course, to flatten the curve to ensure that our health system was not overwhelmed by COVID patients, particularly in ICUs and using ventilators. And we have succeeded remarkably well against that standard. I think we have about 2,400 acute care beds set aside for COVID patients across the province that as of yesterday, at least, with 61 people in hospital, 8 of whom are in ICUs. And so that is about a 1.5% utilization, 2% utilization of the COVID capacity in our healthcare system. And so if that goes to 3 or 4%, that does not jeopardize the capacity of our healthcare system. It would require very substantial growth in the number of cases that are hospitalized to cause real concern about the capacity of the health system, because we bought time to build on that capacity, to set aside more beds. So, David, the premise of your question, I think, is correct. We don't want to move policy on a hair trigger. We have, as I say, we've bought time for a number of things to happen, for people to become more familiar with the new hygiene protocols that we're all living with, this physical distancing, for a lot of public education to happen. We've bought time for employers to adjust their practices and improve their own public health, their own health measures. We've bought time to increase capacity in the health system and to learn more about the disease. And so for all of these reasons, I think we can move forward with a greater level of confidence than we had, say, 10 weeks ago. So we will be having further conversations with the Emergency Management Cabinet Committee. Dr. Hinshaw and her team, Alberta health officials, will be having more discussions about whether we can bring greater clarity to the public about what criteria would trigger, let's say, moving to stage 2 and stage 3 on the relaunch, or any potential stringency measures. But right now, the key metric that we've been tracking is the hospitalization rate, and it's going in the right direction. Doctor, would you like to complement that?
Thank you. So the only additional comment I would make to that is the 5% over 2 weeks hospitalization metric, which isn't just to be really clear, and I think I did not explain this clearly in the past, that what we're looking for is over that 2-week period, over the last 2-week period, have we seen a sustained 5% day-over-day increase, which compounds? So we're not looking at one single 5% increase, as you say, with the numbers declining. And if we have very small numbers, even a single case might potentially, if we had one person in hospital one day and then 2 people the next day, it would be a 50% increase. So we're really looking at compounding that. If over 2 weeks we see a continual increase of 5% or greater day over day for 2 weeks running, that's really the metric we're looking at. And so as the Premier mentioned, we recognize that there's a need to have more technical clarity on the indicators. And so we're looking to put that out on the public website, but hopefully that clarifies the 5% metric.
Operator, can you please put through the next caller?
Next is Emma Graney with the Globe and Mail. Go ahead, Emma.
Yeah, g'day, guys. This question is for the Premier. We saw, and not on topic with airports, I'm sorry today, we saw that the federal government has released more details of the LEAF program today. We're seeing more of the details around the strings that are tied to the loans. Specifically to oil and gas, it kind of seems to be most applicable to those larger mid-tier companies. Just curious over what you're hearing, whether it's enough, whether this program you think needs to be rejigged, whether it's going to help, and just generally your thoughts on the details out of Ottawa today.
Thank you, Emma. So First of all, we were pleased that the federal government did step forward 2 weeks ago with the Large Employers Emergency Finance Facility and earlier with a facility specifically for mid-sized oil and gas companies. Having said that, we are not aware of any company, either mid or large size, that has been able to access the credit facilities that have been announced. And we have continued to work with the Government of Canada, particularly the Minister and Department of Finance, to improve these programs, to see clarity on them, and to the greatest extent possible, ensure a light administrative touch so that they actually are accessible. There's no point in announcing programs that are so bureaucratically opaque and that they are not accessible by distressed employers. So we will take some time to analyze. At 5 o'clock today, I'll be getting a detailed analysis of the revisions that were announced at a high level by the Prime Minister this morning. We certainly agree with the principle that any company that participates in a public credit, a government credit facility of this nature should have certain restrictions on it, that there should not be, those companies should not be able to engage in share buybacks, or that money should not flow to executive compensation or increase dividends, things of that nature. So that absolutely the public interest must be protected, and any incremental credit that becomes available should be for core liquidity purposes so those companies can survive for a better day. Having said that, I'd like to get more information on this 15% equity requirement that was announced today, and this notion of somebody sitting on boards. One thing that we've been concerned about, Emma, we do not want governments directing the operation of companies in terms of micromanaging their decisions. And so that's something that we're going to look at. Now, finally, let me say that the Government of Alberta continues our own work on looking at our own potential credit facility or other backstop to ensure liquidity amongst critical employers in our province. So we've always been working on a plan B in case the federal programs are inadequate to ensure a future for the largest employers in our province, and we're getting close to making decisions on that plan B.
Operator, can you please put through the next caller?
Next is Kendra Slagowski with Global News Edmonton. Go ahead, Kendra.
Hi, Premier. I just wanted to ask you again about the pitch to the NHL. If successful, what would it look like for players with the new screening protocols? Would they go through the same sort of testing? And secondly, what kind of funding, if any, has the province committed to this pitch to the NHL?
Sure. So did you ask about testing in that context?
Pardon me? Sorry?
The first part of the question was what?
If Alberta is successful in its bid to host the teams here, what kind of screening would happen for the players? Would they follow the same screening protocols that you're putting in place now at the airport?
Yeah, the answer to the first question is yes. As international travelers, whether they're Canadian citizens, Alberta residents, or Russians or Americans, doesn't matter. They'll all have to go through the same screening protocols, which should be not difficult for them to do a quick temperature check and provide an isolation plan. Now, I think in that regard, part of the idea of the Edmonton bid is this. We've got the most modern and best arena in the league that just opened a couple of years ago that is connected by a walkway to a brand new hotel with hundreds of rooms. And so there can be a self-isolation zone in principle between where they're staying and where they might be practicing and playing. And we've spoken to the federal government about that, and because obviously the players and their support staff would need to comply not only with our own public health orders, but also with the federal 14-day quarantine requirement for international travelers arriving from abroad. And so the federal government agrees with us in principle that we could designate a kind of isolation zone for a number of people coming in, and that's what we're working on in that respect. And let me say, I know in our preliminary conversations with the NHL, the league, of course, wants to ensure the absolute safety of their players and support staff, and so they will have. I'm quite confident if they come forward with a detailed proposal, it will involve their own supplementary, additional, or even redundant health measures and hygiene measures, and I'm, we could point them in the direction of for example, private lab services from which they might be able to procure more frequent testing for people that come, so they don't have to, so they would not go into the general testing system that we have set up in Alberta. In terms of funding, no, there's been no request for funding. The NHL and these teams are profit-making businesses. They would be getting, obviously, significant television revenues from broadcasting the playoffs, and I wouldn't see funding. Just has not been a question there. So,
okay, we have time for 3 more. Operator, will you put through the next caller, please?
Next is Graham Thompson with iPolitics. Go ahead, Graham.
Hello, Premier. Question about the Keystone XL pipeline again. You talked about this a few days ago about you've done a lot of extreme legal analysis on this. A lot of talk about if Joe Biden wins, he'd revoke the license, and then there'd be massive lawsuits. We're hearing from legal experts that the presidential permit is revocable at any point by the president, and the permit holder would have no claim for damages. So if Biden wants to win, if he wants to revoke the permit, is it still your contention you could actually sue for damages?
Well, TC Energy was suing the United States government for a denial of an earlier presidential permit on a number of different grounds. There's also, of course, international trade law and obligations. So the legal advice we have is that we would have standing, and we would strongly defend Alberta's financial and economic interests. I think it's a broader point here, Graham, which is this is not just about Alberta. This is about Canada. This is about whether or not the government of the United States respects its most important bilateral relationship. And we would fully expect any United States president, regardless of party or platform, to tread very carefully before undermining the single most important bilateral economic project in which a Canadian company and a Canadian government are investing massively to create jobs in the United States as well as in Canada. So, Graham, we entered into this eyes wide open, recognizing that there was, of course, a political risk. It was precisely that political risk which is why we had to step in to de-risk the project. As I said yesterday, I think it was yesterday, this is in some ways analogous to what the Government of Canada did following the withdrawal of Kinder Morgan from the Trans Mountain project because of legal and political risks. The Government of Canada stepped in to effectively de-risk the project with, I think it was if I'm not mistaken, a $7 billion acquisition with several $billion more in construction costs. Our investment in Keystone XL is a fraction of that. Also, let me put this in perspective, Graham. The $1.5 billion Canadian construction preferred equity investment that we've made for construction this year is a fraction of what the federal government put into TMX. It's also a fraction of the roughly $5 billion that the previous Alberta NDP government committed for a crude by rail program, which would only work at a certain price point. It certainly doesn't at this price point, and which would only move an incremental 200,000 barrels per day for a maximum duration of 2 years. Whereas if and when Keystone XL is commissioned, it would move at a minimum of 830,000 barrels a day for decades. And we estimate that over the span of 20 years would represent an incremental boost of $30 billion in royalties and revenues to the government of Alberta alone. So we believe that, yes, it was a bold investment. As I said, the day that we made the investment, it was not without risk. But my view on this was the following, Graham, that this was not the inability of TC Energy to attract private capital to finance the project was not a market failure. It was a political failure. It was the result of political uncertainty. And as a political actor in this government, we felt that because of that, because it is so vitally important to our long-term economic and fiscal future, that we could play a role in de-risking it. Now, as I say, we've received legal advice, and we would not hesitate to vigorously defend our interests should a future administration revoke the presidential permit. But as I said yesterday, our focus would be on working with both the Biden campaign and, if elected, the transition team and a prospective future administration on creating facts on the ground and demonstrating why this project should proceed. And we believe there's a lot of key stakeholders in Mr. Biden's party, including the building trades unions, the construction unions, the steelworkers unions, Democrat governors who support the project, who will speak strongly in favor of it.
We have time for 2 more. Operator, can you please put through the next caller?
Next is Sarah Plowman with CTV. Go ahead, Sarah.
Hi, this is a question for the Premier. I'm wondering, or Hinshaw, I'm wondering what kind of device would be used to check people's temperature, and what happens if someone has a fever?
Sure. So in that respect, there will be, as of next week, putting infrared scanners in those international arrivals areas. And if people are found to have a temperature initially, then they'll do a second check with a thermometer to confirm whether or not they in fact have a temperature. Doctor, would you like to fill in on the details?
So as mentioned, there would be the thermal scanner screening that someone would walk through, and then there would be a handheld thermometer that's a touchless thermometer, so similar to the kind that are used in some hospitals and scanning, where it uses a sensor rather than actually touching the person to prevent the spread of infection. If somebody is found to have any of the key symptoms of COVID, there's also the questionnaire asking if people have a cough, sore throat, runny nose, shortness of breath, or fever. And if they have any of those symptoms, then it will be part of the discussion to make sure that they have a safe way to get home for isolation. And if they don't have a way to get home for isolation without potentially exposing others, that would be where the quarantine locations would come in. And so, as the Premier has mentioned, there would be locations where people could stay if they weren't able to get safely home to a place where they could be away from others for, if they were symptomatic, could potentially be then 10 days if they're ill with COVID, and also to make sure that they have access to testing wherever they are, if they're going to their home or if they're going to be staying in that location at the airport.
Okay, operator, could you please put through the,
I'm just going to, sorry, go ahead. Yeah, no. Next question. I apologize.
International travel play in spreading COVID-19 in Alberta?
I think I missed the first part of that question, sorry.
Sorry, just following up on her behalf, I believe the question was, what role did international travel play in the spread of COVID in Alberta?
Well, I'll invite again Dr. Hinshaw to add to this answer, but obviously the first cases in this province came from international travel, and it was, I think, well into perhaps the third week of the presence of the virus in Alberta before we started to see significant community contagion. A lot of those first cases came from people arriving from cruise ships, but I can also say that very clearly the first cases in Canada, in Vancouver and Toronto, came from international travel, disproportionately from folks arriving from a hotspot, in that case from Tehran, and as well as cases that arrived here from people who had been on cruise ships. So let me just go further to say that I think this was a mistake, that Canada should have followed the example of some other jurisdictions like Taiwan, Singapore, and South Korea. Perhaps because of their proximity to China, they knew to be skeptical about frankly, the cover-up about the nature of the disease when the Chinese government was claiming that there wasn't really a serious influenza. While they were closing the borders of Wuhan to the rest of China, they were allowing Wuhanese travelers to fly to the rest of the world. They seemed much less careful about global health and then their own domestic population's health. And they were even, of course, denying that there was evidence of human-to-human transmission while arresting and detaining and suppressing scientific whistleblowers who were trying to bring that information to the attention of both Chinese and international communities. So in that period, we're talking here December, January, a number of the neighboring Asian countries, they knew something was happening that was deeply problematic, and so they suspended arrivals from the hotspot. And in the case of Taiwan, at least more generally. And I just think when we all look back on this, that will be seen as a critical point. Here in Alberta, obviously, by the time that the virus arrived here, there had already been fairly widespread global spread of the influenza. And that is one of the reasons why. Look, I guess one of the reasons we're taking these measures today is this. Albertans have made enormous sacrifices. There's been huge economic pain. Some people's lives have been turned upside down. We've made enormous gains in combating it, bringing the curve back down, keeping that capacity in our healthcare system, performing very well again, compared to other jurisdictions. And I just don't want to see those sacrifices wasted or those gains lost by not taking every necessary precaution at the borders for international arrivals. I will say this, at some point, we're going to have to figure a way to apply smart and rigorous border screening, which does facilitate international travel at the same time. And that's what a lot of places around the world are thinking about, is how do you do that? Because you can't get the economy moving on back at full potential unless or until we see an increase in travel. So in a way, these measures are getting ready. They're kind of a preparatory measure for an expected increase in travel down the line. And with that, do you want to comment on international travel?
Thanks, Premier. The only additional thing I would say is that, as mentioned, the vast majority of our cases in the first several weeks of our epidemic here in Alberta were imported cases from international travel from all over the world. The country that we have the most cases originating from is the United States, so we did see many cases coming into Alberta from the U.S. And I would also just flag that we do continue to see, even though our travel volumes have decreased, we do continue to see imported cases. And that's why it is so critical that anyone who is traveling respect that 14-day quarantine period when they return, because while we're cautiously relaunching here and in other places, COVID is still out there. It's still circulating around the world, and that 14-day quarantine period is essential.
Okay, we'll leave it there. Oh, sure.
I just wanted to make one additional remark. While we did have, we can have a debate about Canada's timeline on responding to imported cases, I do want to thank the Government of Canada for the measures that have been taken more recently, and particularly Deputy Prime Minister Freeland, who has been working with us in a cooperative spirit on the measures that we've just announced, and has broadly indicated support for these measures. And also want to commend Premier Horgan in British Columbia for his leadership in some of these measures as well, because a lot of the people who arrive from abroad to Calgary transit through the Vancouver airport. So this is another good example, I think, of the collaboration that we're seeing amongst governments in Canada to keep Canadians safe. Thanks very much.
Thanks.